Good afternoon. My name is Priscilla Batarse, and I conducted a systematic review evaluating the effectiveness of oral omega-3 fatty acid supplementation in reducing depressive symptoms. In the following slides, I will delve into the findings and insights I uncovered. Let's talk about the objectives for this presentation. I will evaluate the impact of oral omega-3 fatty acid supplementation on reducing depressive symptoms in adults who are diagnosed with clinical depression, synthesize findings from chosen studies to offer evidence-based conclusions, and discuss the implications of these findings for both research and practice in the realms of nutrition and mental health. Presentation background. In this presentation, I'll offer a concise overview of the prevalence and impact of clinical depression, emphasizing its significance in public health. I'll dive into the challenges individuals face when dealing with depressive symptoms and underscore the need for effective treatment strategies. Specifically, I'll explore the potential of adjunctive therapies, and specifically for this research, omega-3 supplementation in managing depressive symptoms, shedding light on their role in improving mental health outcomes. Okay, so let's now explore a variety of foods rich in EPA and DHA, two essential omega-3 fatty acids crucial for our health. Fatty fish like salmon, trout, and tuna are excellent sources. They offer a significant boost to brain function and heart health. Plant-based alternatives such as flax seeds, chia seeds, and walnuts can also provide these vital nutrients. I'll discuss how EPA and DHA play a pivotal role in reducing inflammation associated with a lower risk of depression and improved cognitive function. Additionally, eggs and grass-fed meats can contribute to omega-3 intake, particularly when sourced with animals fed omega-3 rich diets. While their APA and DHA levels may not match those of fatty fish or plant-based sources, incorporating them into a balanced diet can still offer benefits, with grass-fed meats generally containing higher omega-3 content. Now let's talk about what depression is. Per the DSM, depression is a mood disorder marked by persistent sadness, hopelessness, and disinterest in activities once enjoyed. It disrupts daily functioning. Some of these symptoms include persistent sadness, changes in appetite or sleep, fatigue, worthlessness, difficulty concentrating, and at times thoughts of suicide. Its severity varies, impacting individuals of all ages worldwide. However, specifically for this research study, we are focused on individuals between the age of 18 and 65. According to the World Health Organization's latest report in 2020, depression is a multifaceted condition shaped by a myriad of factors. Delving deeper into these influences, as outlined in the Diagnostic and Statistical Manual of Mental Health Disorders, the DSM, published in 2022, we find a complex interplay of biological, psychological, environmental, medical, and behavioral elements. Biological factors, including neurotransmitter imbalances and genetic predispositions, lay the foundation for understanding depression's physiological roots. Psychological contributors such as traumatic experiences and individual coping styles also shed light on the emotional and cognitive dimensions of depression. Environmental stressors, ranging from life events to social isolation. This further exacerbates depressive symptoms. Medical conditions, particularly chronic illnesses, often intertwine with depression, complicating diagnosis and treatment. Additionally, substance abuse emerges as a significant risk factor, highlighting susceptibility to depressive episodes. Recognizing this intricate web of influences underscores the complexity of depression and underscores the need for a holistic approach in its management. In today's presentation, I will be exploring a compelling research question. What is the impact of oral omega-3 fatty acid supplementation, specifically combining EPA and DHA at dosages ranging from 1,500 to 3,000 milligrams compared to a placebo or standard treatment without omega-3 supplementation. Our focus will be on evaluating how this supplementation regimen influences the reduction of depressive symptoms as measured by standardized depression rating scales over a 12-week period. This question delves into the potential benefits of omega-3 fatty acids in managing depression, offering valuable insights into adjunctive therapies for mental health treatment. Now let's explore the relationship between omega-3 fatty acids and depression. Research indicates that omega-3s may impact mood regulation, influence neurotransmitter pathways, and contribute to inflammation reduction within the body, all of which play a crucial role in mental well-being. However, despite promising potential, research findings on the effectiveness of omega-3 supplementation in alleviating depression are varied, with some studies suggesting a positive correlation between omega-3 intake and reduced risk of depression. These mixed results highlight the complexity of the relationship and underscore the need for further investigation. While omega-3s hold promise as complementary additions to traditional therapies for depression, such as medication and psychotherapy, it's essential to continue exploring their efficacy through rigorous research to really better understand their role in mental health management. For the methodology, I established specific inclusion criteria to ensure the relevance and quality of the studies included in the review. Firstly, the study focused on adults aged 18 to 65, as depression can affect individuals within this age range significantly. Secondly, studies were conducted in a diverse range of settings, including outpatient clinics, primary care practices, mental health centers, or research institutions involved in clinical trials related to depression treatment to ensure a comprehensive understanding of the depression treatment across different contexts. Thirdly, targeted otherwise healthy individuals with comorbidities and acute or chronic illnesses to isolate the impact of depression and its treatment. Moreover, we specifically look for individuals diagnosed with depression according to the DSM criteria, ensuring consistency and accuracy in our selection process. The study established clear exclusion criteria to ensure the integrity and relevance of our review process. Excluded individuals outside the age of 18 to 65-year-old age range and non-clinical settings to maintain consistency in our study population and setting. Individuals without a diagnosis of depression, pre-existing medical conditions, or those taking medications that could potentially affect the effects of omega supplementation. Pregnant or breastfeeding individuals with adverse reactions to omega supplements, as well as those currently undergoing mental health treatment, were excluded to minimize confounding factors. Furthermore, to ensure the precision of the study population, individuals with comorbidities, acute or chronic illnesses, and high omega levels confirmed by the lab test were excluded as well. Lastly, non-controlled trials, case studies, and before-after studies were excluded to prioritize the inclusion of high-quality research with robust methodologies. This slide showcases the systematic review process. Initially, a total of 5,897 records were identified through database searching, primarily from PubMed and ScienceDirect. After removing duplicates, 5,781 records remained. From these, 367 records were screened, and 43 full-text articles were assessed for eligibility. Ultimately, 4 studies were included in the qualitative synthesis. Reasons for excluding articles included participant age under 18 or over 70, pregnancy, and variations in trial durations. In this section, I will delve into the research findings from 4 key studies included in the systematic review. So let's start with Park et al. 2015. This study, conducted in South Korea, investigated the supplementation of omega-3 fatty acids for major depressive disorder. The findings shed light on the potential benefits of omega-3 supplementation in alleviating depressive symptoms. Tamaya et al. 2018, conducted in Japan, this study focused on combining omega-3 fatty acids and psychological intervention for workers who were experiencing mild to moderate depression. It provides valuable insights into the effectiveness of a combined approach for managing depression in a specific population. Mesculin et al. This research, conducted in 2022 in the USA, explored the use of omega-3 fatty acids specifically for major depressive disorder characterized by high levels of inflammation. The study offers valuable insights into tailoring treatments for depression based on individual inflammatory profiles. In another study, Yang et al. 2019 from Taiwan, this study investigated the clinical efficacy and biological mechanisms underlining omega-3 fatty acid supplementation in major depressive disorder. It provides important insights into potential novel therapeutic avenues and the biological underpinnings of omega-3 supplementation in managing depression. In this study, Park et al. 2015 conducted a randomized double-blind placebo-controlled trial in South Korea to investigate the effects of omega-3 supplementation on adults diagnosed with major depressive disorder. Over a period of 12 weeks, participants were randomly assigned to receive either omega-3 fatty acids of 1,140 milligrams of EPA plus 600 milligrams of DHA daily or a placebo. The results indicated a reduction in clinical global impression improvement scores among major depressive disorder patients who received supplementation, indicating its potential as an adjunctive therapy. However, it's important to note that certain exclusion criteria employed in the study may restrict the applicability of these findings to broader populations. Tayama et al. 2018 conducted a randomized controlled trial combining 1,064 milligrams of EPA and 558 milligrams of DHA daily with psychoeducation or psychoeducation alone in treating mild to moderate depression among workers in Japan. Participants aged 20 to 60 were randomized for 12 weeks. The study found no significant difference in effectiveness between the two approaches, suggesting that psychoeducation alone may suffice. However, both groups showed high compliance, though potential biases in self-reported capsule intake and dropout rates were noted. In this study, Mesculin et al. 2022, in a double-blind randomized controlled trial, tested different amounts of EPA doses of 1,000, 2,000, or 4,000 milligrams against a placebo in adults with a diagnosis of major depressive disorder and high inflammation. They found that 4,000 milligrams of EPA reduced depression in people with high inflammation. The study suggested that lowering inflammation might help with depression. However, there could be errors in how people reported their symptoms, and not everyone could join the study, which might affect how well the results apply to everyone. In their 2019 study, Yang et al. Explored omega-3 fatty acids as potential treatments for depression. They conducted a 12-week randomized controlled trial on participants aged 18 to 65 diagnosed with major depressive disorder per the DSM, assigning them to receive EPA of 3,000 milligrams a day, 1,004 milligrams of DHA a day, or a combination of 1,500 milligrams of EPA and 700 milligrams of DHA daily. Results revealed higher clinical remission rates in the EPA and EPA plus DHA groups compared to the DHA group alone. Omega fatty acids derived EC levels were positively linked to remission rates, indicating EPA-enriched treatments might elevate plasma EC levels, offering a new therapeutic avenue for major depressive disorder in this specific study. Now for the summary of findings. Numerous studies have underscored the promise of omega-3 fatty acids as a supplementary therapy for major depressive disorder. While certain studies have demonstrated the effectiveness of omega-3 supplementation in mitigating depressive symptoms, others have suggested that psychoeducation alone can be adequate for addressing mild to moderate depression. Notably, the symptoms of major depressive disorder were alleviated with EPA supplementation, particularly among individuals exhibiting elevated inflammatory markers. Moreover, exploring omega-3 supplementation has unveiled a potential novel therapeutic avenue for major depressive disorder. However, it is essential to acknowledge that the exclusion criteria employed in these studies may constrain the broader applicability of their findings. The conclusion statement is supported by results from 4 studies of strong design: oral omega-3 fatty acid supplementation, EPA and DHA, between 1,500 and 3,000 milligrams over a 12-week intervention significantly alleviates depressive symptoms in adults between the ages of 18 and 65 with clinical depression, as shown by standardized rating scales. It consistently outperforms placebo, suggesting promise as an adjunctive therapy for managing major depressive disorder. In this next section of the presentation, we're going to examine the strengths and limitations of the systematic review. Okay, now let's highlight the strengths of our systematic review. Strong evidence supports the use of omega-3 fatty acid, dosages ranging from 1,500 to 3,000 milligrams over a consistent 12-week intervention period. This comprehensive overview provides robust evidence of the intervention's efficacy. Rigorous inclusion criteria were applied, encompassing studies with strong design, such as randomized controlled trials. This ensures the quality and reliability of the evidence included in this systematic review. Transparent reporting of outcomes, including the use of standardized depression rating scales, allows for clear interpretation and synthesis of the intervention's effects of depressive symptoms. This enhances the reliability and validity of our findings. Now let's discuss the limitations of the systematic review. Variability in dosages and formulations of omega-3 fatty acids across studies complicates direct comparisons and result synthesis. Dosages range from 1,000 to 4,000 EPA and DHA, which may impact the consistency of our findings. Potential biases in self-reported intake, as observed in the study by Tayama et al., may affect the reliability of the data and introduce inaccuracies into our analysis. Dropout rates and publication biases may skew results and overestimate the effectiveness of the intervention. This could potentially influence the overall interpretation of the findings. Variations in participant characteristics and baseline depression severity across studies introduce confounding factors that may affect the transferability of our conclusions. These factors should be considered when interpreting the result of our review. In this section, we're going to explore the implications for research and practice. Future research should focus on determining the optimal dosage, duration, and formulation of omega-3 supplementation for treating major depressive disorder, while also investigating their mechanisms in alleviating depressive symptoms. Understanding omega-3's effective neuroinflammation, neurotransmitter function, and neuroplasticity can aid in developing new therapeutic targets for improving mental health outcomes. Now on to implications for practice. Healthcare practitioners may find value in incorporating omega-3 supplementation into standard treatments for major depressive disorder, particularly for patients seeking non-pharmaceutical approaches or experiencing insufficient responses to traditional treatments. Nutrition and healthcare providers hold a pivotal role in informing depressed patients about the advantages of omega-3 fatty acids. stressing the significance of treatment compliance and consistent symptom monitoring to optimize treatment efficacy. This concludes my presentation. Let us persist in the exploration and advancement of our comprehension surrounding mental health and its therapeutic interventions. Thank you for your attention and engagement in this presentation. I have attached a reference list for your notes. This reference list encapsulates the scholarly sources utilized in the presentation today, facilitating further exploration and scholarly discourse. Again, thank you.